welcome to Adira's tutorial. Today I am going to discuss a topic from child health nursing, and which is one of the important topic, that is congenital heart disease. So it is a vast topic, so I think I can't able to finish it within one video, so I will be uploading it as parts. So congenital heart disease, as the name suggests, congenital means it is a birth defect. So congenital heart disease means it is a birth defect which is occurring to the heart structures, which can be of any type, maybe any holes in the wall, or any holes in the heart, or any some problem with the heart vessels, heart valves, or any problem with the blood vessels. So that is called as congenital heart disease. So congenital means it is by birth, or it is a defect which is present in the heart by the time of birth, and that may be any problems in the heart valves, or any problems in the blood vessels, or any problems with the heart walls. That is called as congenital heart disease. So congenital heart disease is majorly classified into three. First one is cyanotic heart disease, second one is acyanotic heart disease, and the third one is obstructive. So today we are going to see that acyanotic heart disease. So acyanotic heart disease, it is one of the most common type of heart disease, and in this what happens means the blood will be pumping throughout the body, but it is in an abnormal manner. The blood will be pumping throughout of the body. And this acyanotic heart disease, under that we can see mainly three types, that is atrial septal defect, ventricular septal defect, as well as patent ductus arteriosus. These are the three major types which is coming under acyanotic heart disease. Once again I will repeat, that is atrial septal defect, ventricular septal defect, as well as patent ductus arteriosus. So today I think I can finish it off atrial septal defect. So atrial septal defect means, as a name suggests, atria as well as septal. So septal means it is a wall which is present between the atria of the heart, or we can say that it is a bridge which is present between the left atrium as well as the right atrium. In atrial septal defect, we can see there may be some abnormal openings which is present between the left and right atria of the heart. And again, this atrial septal defect is having another classification or another types. So that is, first one is ostium primum. Ostium primum, according to the location of the hole which is present in the septum, we are classifying this three types. That is, in ostium primum we can see there may be some defect which is present in the bottom of the septum. That is, bottom of the atrial septum, there may be some defect which is present. That is called as ostium primum. Second one is ostium secundum. And ostium secundum, it is the most common type of atrial septal defect, and here we can see there may be some defect which is present in the middle of the atrium, that is left atrium on the right, in between that left and right atrium, that is ostium secundum. And the last one, or the third one, is sinus venosus. Sinus venosus, here we can see there may be some defect which is present in the superior part of the atrial septum. That is, especially we can say that where that inferior vena cava is opening, there we can see some defect in the septum. That is called as sinus venosus. So these are the three major types of atrial septal defect. And coming to that clinical features, we can see the child who is presenting with this atrial septal defect, they will be having that clinical manifestation, especially poor growth, then hypotension, any kind of heart murmurs. Murmurs means there will be a swishing sound. When the blood is flowing through the heart, we can see a swishing sound. And when we are doing that examination, we can hear a wide split S2 sound. That is, a wide split S2 heart sound will be here when we are doing that physical examination. Then lethargy, as well as we can see right ventricular hypertrophy. So these are the major features we can observe in the child with the atrial septal defect. So that is the clinical manifestation. Then coming to the diagnostic evaluation, the major diagnostic evaluation we can do physical examination, then ECG, X-ray, echocardiogram as well as MRI. These are the diagnostic evaluations we are suggesting for atrial septal defect. And while doing X-ray, it is showing that there is a cardiomegaly, or that is the result we can observe from the child who is suffering with the ASD. In the X-ray, they will be having a cardiomegaly. And in that ECG also we can see there will be a wide PR interval. The PR, there will be a prolonged or wide PR interval can be observed in ECG. So that much regarding the diagnostic evaluation. And coming to the treatment, we can see that if the closure, if that septum is having a diameter lesser than 3 mm, there is no requirement of any treatment. It will be closed by its own spontaneously. That is, if the hole is greater than 8 mm or it is wider than 8 mm, there is a surgery is required. And the surgery, there is no requirement of any open heart surgery. We have to do some patch closures. And the patch closure we are doing here is track and patch closure. That is the closure we are doing here, or precordial patch closure. These are the two major surgical management we are doing for atrial septal defect. Once again I will repeat, if the size is lesser than 3 mm, there is no requirement of any kind of surgical management, or if it is greater than 8 mm, we have to do the surgical management, that is patch closure is the procedure we will be suggesting for that. That is track and patch closure as well as precordial patch closure. These are the two surgical procedure we can do for atrial septal defect. I hope you understood regarding atrial septal defect. I will continue the class with the ventricular septal defect in the next class. Thank you.